My name is Dr. Keith Gray. I am an associate professor of surgery and also chief of the Division of Surgical Oncology. What led me into the treatment of cancer patients is really more of what led me into medicine. As a child, I knew I wanted to be a surgeon at age 14, but I think what got me interested in medicine was just being interested in healing and also being interested in serving. I combined that desire to serve with a love of human anatomy and just how the body works and how it's pretty hard to mess up the human body, and just realized that I wanted to pair those two loves and study medicine for the rest of my life. Went to medical school or undergraduate school and medical school at Wake Forest University in Winston-Salem, North Carolina, and then moved to Tennessee for my general surgery residency. I went to Vanderbilt for my internship and residency, and after that went on to MD Anderson in Houston for my specialized training in surgical oncology. Really, like growing up in a rural farming town in eastern North Carolina, I didn't really know a lot of physicians, but I knew what my passions were, and I think the greatest benefit or the greatest asset were my parents. They didn't really see anything that was too big for me to do, despite coming from a small town. And when I shared it with them, they said, hey, let's figure out how to do it. And I think what brought me here to the University of Tennessee Medical Center in Knoxville is initially was geography. I think I felt a peace in a word when I visited here that I didn't feel other places. That's been confirmed over the last 11 years. I've had the opportunity, as I mentioned before, to be at 3 different places before I came here. And I think we not necessarily do cancer care better, but we do care of the patient better than any place that I've ever been. Part of that is a compassion with excellence that is not always seen at every organization. It is also a collegiality that is second to none. I think we work together as healthcare providers here in this organization better than anywhere that I've been and anywhere that I've heard my colleagues who train with me talk about. In the Cancer Institute here at UT Medical Center, it's required that you do that to take good care of cancer patients. It's required that you collaborate. It's required that you work well together to offer the best outcome for your patients. And we do that because we're close in proximity. First of all, when you enter the doors, I want us to make you feel that you're welcome. I want you to feel like we were only concerned about you during your time here, that we weren't distracted by other things, that we had done our homework about your disease process, that we have given you a treatment regimen that was in line with the standard of excellence that is known across the country for this disease process, that we dealt with you in a compassionate way, and that when you left here, all of your questions were answered. So my family, big family, we've been married for 21 years, and we have 5 children ranging in age from 9 to 17. Great kids, and my goal for them is just to be excellent in whatever God has given for them to do. I'm very, very proud of my family. That's my top priority, and I think we've grown to love Knoxville. And I think the major reason is because of the people here. The people here are genuine and very appreciative of the things that we do in the community.